So we're gonna get started while we're waiting for other people to join us. So first of all, if you are new to us, I would like to start by introducing myself. I'm Dr. Marina Pshay, so I am a certified family physician who has been practicing in Barrie since 2017. Before being in Barrie, I was practicing in Newfoundland for a couple more years. So I have been certified with the Medical Council of Canada for 12 years now. I've been practicing as an independent physician for the past 12 years. That's after practicing as a physician in Egypt for a couple years before moving here. So, all through the years of practicing as a family physician, I was able to get exposed to a lot of challenges and a lot of conditions that's a little bit harder to treat. And that made me thinking that there must be more than what the traditional medicine can offer. There must be more options for people to enjoy a good quality of life, not just to treat medical conditions. So I started to do a lot of training in functional medicine, integrative medicine, as well as aesthetics and sexual enhancement. That's because I started to realize that just offering prescriptions on its own cannot be the answer all the time. Sometimes my clients and my patients will be looking for a lot more than just giving them a prescription and letting them go. I started to look in depth. How can I help my patients more? And what can improve my clients' quality of life? I started to get into hormone replacement. I started to learn a lot more about hormones. I started to learn that female patients can go on testosterone therapy, and that can help with so many conditions that we never had any treatment for. I started to get in a lot of depth into sexual enhancement, realizing that having a good, healthy sexual life is a crucial component of having a good relationship in general. I also wrote so many articles before in the Good Life magazines. So if you guys are in Simcoe area, you probably have seen my articles in the past. I used to have articles coming out with every single magazine. The past couple of issues, I was just so busy to hand new articles, so maybe you haven't seen it. But before that, we used to have articles coming out all the time, and I used to get clients coming to ask me about these articles. I'm also working on my first book. I have lots of ideas that's been discussed with so many clients, and that gave me the idea that I might as well just have it all in one place, in one book, and have it available for everybody to have access to. So I'm so happy to share all of these updates with you. And I'm so happy to announce that we always have surprises coming up and we always have things to share. So today's topic is very interesting, which is learn how to lose body fat fast. And if you've been trying to lose weight in the past, you probably had lots of frustrations before. And today I'm here to discuss with you how we can target not only weight loss, but also fat loss very effectively. The reason why I decided to have this webinar today is we had launched a weight loss slash fat loss program back in July, I believe, of last year. And we had amazing success with our clients in terms of being able to lose weight, unwanted weight for the first time in their lives, plus also being able to lose fat. So I just want to explain to you this very briefly here. There is a big difference between just weight loss and the fat loss. In terms of fat loss, I've seen a lot of my clients who are very physically active, very physically fit. They go to the gym, they exercise, they eat healthy. However, they always have those stubborn pockets of fat that's very difficult to get rid of. So they came for me to help them with that, and they were very satisfied with the results. So welcome to our spa. We have such an amazing location located on Bayfield in Barrie, right on Bayfield Street. If you know Winners and Market Warehouse on the north end, this is where our amazing place is located. I had a vision of having everything under one roof. Beside my family practice that is next door to my medical spa, I also started to think about having one place that covers basically everything that I want to offer to my clients. So between myself and my husband, who helped me a lot through the process, we were able to bring this dream to reality, and we were able to open this amazing location that we would love to share with you. We have over 6,000 square feet now that's able to help clients with so many medical as well as cosmetic conditions. So between treating hormonal imbalance, challenges that most of the ladies and men can face, boosting confidence, embracing your beauty, we were able to put things together, and there is a lot to share with you. So it's time to get ready for the summer, and we're all excited to have those sunny days finally after this rough winter that we had this year. If you have been living in Ontario, you know exactly what I'm talking about. So we need to prepare our summer body now, not last minute. So as long as we love the sun, but we also want to make sure that we're also protected from the sun damage that can happen, which I can also discuss with you after. So we're not going to be talking to you today about certain diet that you have to follow for a period of time, and then you're on your own after. Because if you have tried this before, this is probably where you had the frustration, and this is probably why you had unsuccessful weight loss in the past. What I try to do here is completely different. What I try to do here is I empower my clients. I educate them a lot. I explain to them why we put on the unnecessary weight from the beginning. And once we identify the problem, we will be able to deal with it effectively. I also explain to my clients a lot of the factors that can affect the process of weight loss. I also have to say that we have lots and lots of materials that I always share with my clients when they show up for their weekly appointments. And touching up here on weekly appointments is very important because when you are part of the program, when you're coming on regular basis, this is what makes it very successful. You have to be part of the success. We cannot be successful without you being involved. So making a commitment is a huge thing. If you cannot make it physically here every week, you can definitely do phone calls. Like we do phone calls and we do virtual appointments for some clients if it's harder for them to be physically here every week. So addressing the root cause basically is the main thing. We need to understand why we are having issues with the weight. And once we address the root cause, we will be able to correct it greatly. I also have to say that Health Canada has been categorizing obesity as a chronic medical condition. So obesity now is a lot more than just fitting in a nice dress. Obesity is, of course, a cosmetic concern for so many of us, but as a physician, I always look at things from the medical point of view. We know now that obesity can be a root cause for so many other medical conditions. It can be a root cause for diabetes, heart problems, joints problems, stroke, a lot of types of cancers. And we know that once we're able to correct obesity, people can drop some diabetes medications, blood pressure medications. We can minimize the risk for stroke, heart problems, and so many other conditions. Joints problem, acid reflux, all of these conditions can be a result of obesity. So treating obesity now is becoming a crucial and mandatory thing more than just a cosmetic option. So a lot of times when I see my clients, I can tell that they are having a lot of stress just by looking at their fat distribution. Why? Because if you have a lot of stress in your life, if you're lacking a good lifestyle, if you're not sleeping very well, that will always put your cortisol level very high. When your cortisol goes up so high, that will definitely give you a lot of fat around your truncal area, even in your face, your unwanted fat all over your body. So these are all signs that we have unwanted body fat in certain areas that is cortisol related. I will talk to you briefly now about how we can get our hormones under control just by doing some lifestyle modifications. So stay tuned for that. Physical activity is huge. I always make it very clear to my clients that never exercise and go to the gym to lose weight, because that might not happen. But we exercise not necessarily to lose weight, but because we want to stay healthy. We want to build our muscle mass, we want to maintain our bone mass, and we want to keep ourselves in a good shape. So the whole purpose behind us talking about weight loss is it's all about how to live healthy and how to minimize medical conditions that can be avoidable. So we have in medicine any risk factors. There is avoidable risk factors or modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors, for example, is your genetics. This is something you cannot change, your age, your background, ethnicity. These are all non-modifiable risk factors. However, there is modifiable risk factors that we can work on, like smoking, for example, adjusting your weight, quitting bad habits. These are all modifiable risk factors. So if we're able to modify that, let's do it together. And let me show you how we can help you in that. So this is why we always say it's not about being thin. It's about being healthy, energized, bring your confidence back, bring your beauty back, and bring your health back, most importantly. So we touched base on the medical importance of the weight loss. So we talked about how obesity now has been categorized as a medical condition that can affect so many factors and it can affect so many organs in our body. We notice that sometimes when people are able to adjust their weight, they might be able to stop using their CPAP machine if they were diagnosed with sleep apnea. They might also drop some diabetes medications. Of course, I'm not asking anyone to change any meds at this point. We need to make sure that you will be able to discuss that with your physician before you change any medications. But I have seen it in my family practice so many times when we're able to get things under control just by adjusting the weight. So there is a lot of details here that I want to just touch up very quickly with you on. So heart problems, we talked about that, diabetes, hormonal imbalance, and overall maintaining healthy weight supports your long-term cardiovascular and endocrine system. So this is all what we are aiming to, adjusting your health more than anything else. Now, when we touch up on the weight loss and the fat loss, this is a big topic that I would like to discuss with you in detail. So at the beginning of the webinar today, we talked about how weight loss can be completely different than fat loss. Let me explain to you this in details now. So weight loss basically is when you lose weight generally from your whole body, which is sometimes is important. But when we're talking about healthy options, we really want to touch base on fat loss. And when we talk about fat loss, there's two types of fat. There is visceral fat. The visceral fat is the fat that is underneath our skin, really deep in our body, covering our organs, pushing on our blood vessels, pushing on our liver, causing the fatty liver, pushing on our kidneys. And this is the visceral fat that's driving our blood pressure high because it's precipitating in the wall of our blood vessels, as well as it's also pushing on the blood vessels from the outside. So the visceral fat is the fat that's really deep inside. Because we don't see this fat, it doesn't bother us. However, this fat is actually more dangerous than anything else. So it's very important to target the visceral fat. It's crucial that we cleanse this visceral fat that's pushing on our organs and affecting our organs' function. If you have ever been diagnosed with fatty liver, for example, your doctor probably would have told you that at one time of your life, your liver function was high. What that means is the fat that's pushing on your liver started to affect your liver function. Why this is very important to treat? Because fatty liver is number one reason why people will end up with cirrhosis, and cirrhosis can lead to liver cancer. So when we're talking about cleansing the visceral fat, it's a lot more than just fitting in a nice dress. It's a lot more into how to live healthy and how to cleanse your body from the fat that has been precipitating there for years and years. Imagine if you are driving with your car the whole winter without taking your car for a car wash. How will your car look like by the end of the winter time? Excuse me? I don't think it will look so nice. So I don't know if anyone has any questions so far, but if you have any questions, you can feel free to write it in the chat box. And I have Randy here. He's monitoring and he's recording, and he will keep tracking if you have any questions. If you have any question that's related to this topic, feel free to ask right away so we can answer as we go. If you have something to be discussed later on, we'll keep it for when it's the time to discuss it. Going back to the visceral fat, this is a huge topic, and this is why I want to really stop here and elaborate a lot on it. Because this is probably something that you never had your regular doctor talking to you about it. So visceral fat basically is a fat that is really deep in our stomach, deep in our organs, covering and pushing on our organs. What are the options to clean and detox the visceral fat? So we have a couple of options here, how to cleanse this deep fat and how to take your liver basically for a car wash. One of these options that I love so much is called glutathione. Glutathione basically is, it's a natural amino acid that we use as injection. It's a very quick injection that you can have at the clinic here, or we can do it as IV. Of course, you can also use a glutathione as tablets, but when you take anything as supplement tablets, it goes through your stomach acid. The amount that will get absorbed is very minimal compared to if you take this big bag of glutathione right into your veins, circulate into your body, and go right away to your organs and cleanse it. Glutathione is a great way to clean the visceral fat. I call it liver vitamin. It's great for your liver health. It's great to boost your immune system, plus it's also anti-aging. It rejuvenates your cells. So I personally was getting my glutathione all through the winter time. Every 2 weeks, I still get it till now because I don't want to risk being sick. And it's also interesting here, I have to mention this story very quickly. When I was off for the Christmas time for 2 weeks, I had a couple of my clients waiting for the Christmas break to be over so they come back for their glutathione injections. And they all came back to me telling me exactly the same story. I had 4 people coming on one day telling me exactly the same story. They are all telling me that everybody in my family gets sick. I'm the only one who didn't get sick. That is because they were getting their glutathione shots on regular basis. So no kidding, nobody wants to deal with pneumonia, and staying healthy is priceless. So glutathione is not just gonna boost your immune system and keep you healthy, but it will also help to cleanse your liver, detox your visceral fat, and cleanse that. And it's also great anti-aging because it rejuvenates your cells, so it brings the collagen back to your cells. Another thing that I also love to talk to you about, especially when it comes to the visceral fat, is MIC. MIC injection is something that we also do here. MIC, we combine it with B12. MIC stands for 3 different amino acids that actually helps to cleanse your visceral fat as well as the fat that has been deposited into your blood vessels. So it cleanses that and it helps to boost your metabolic rate and boost your energy because it has a methylcobalamin. Methylcobalamin is completely different than the cyanocobalamin, one that you buy from pharmacy. And it's the most active form of vitamin B12. Chances for you to have better energy when you're getting the methylcobalamin is so much higher. Excuse me. So it's very important to cleanse the visceral fat. So remember we talked about there's 2 types of fats. The first one that we already talked about is the visceral fat. We need to cleanse that and we need to get rid of it. The other type of fat is the superficial fat. The superficial fat is the fat that we have here in our stomach, the love handle, the bra lines, our arms, and our thighs. Basically, this is the fat that we can see, and because we can see it, it bothers us so much. So I will discuss with you how we can also target that. When we get rid of the extra fat here in our stomach, in our arms, thighs, wherever, cellulite, that's great for boosting our confidence. It's also great to get rid of this extra weight that can also be putting so much pressure on our back, our hips, our knees. So we have some options here that we can discuss, how to body contour and how to get rid of the superficial fat. So let me talk to you about some options that I personally have tried with many of my clients, and I find that they are super powerful and super successful. One of the great options I love to discuss with everybody is called the deoxycholic acid. Deoxycholic acid basically is medication, but we originally have deoxycholic acid in our body. Every time we eat fatty food, our liver will produce the deoxycholic acid that's being stored in our gallbladder. So the gallbladder will release the deoxycholic acid. Deoxycholic acid fights with the fat cells. When the deoxycholic acid fights with the fat cells, it will break down the fat cells and the fat cells will be digested and our body will be able to get rid of it. Imagine that we're able to have this deoxycholic acid in a vial now, and we can take this deoxycholic acid, inject it directly into the unwanted superficial fat in any area in our body, and that will go right into the fat cells and target these fat cells, break them down, and your body will be able to melt and get rid of the fat cells permanently. This is a very powerful way of cleaning your superficial fat and melting them permanently. It's extremely powerful. We even use it for the submental fullness here or the double chin. We can call it because it's very powerful in clearing that. As much as I love the deoxycholic acid injections because it's super powerful in cleaning the fat cells, however, it does not cause any tightening. So it helps to melt the fat cells, but after we do a couple of sessions of deoxycholic acid injections, we don't want to end up with any hanging skin. We don't want to end up with any loose skin. What we want to do instead is we want to continue to melt the fat, and we also want to tighten the skin so things will look so much nicer. So this is when the laser and the radio frequency comes in place, because laser is a great way to heat up the cells so it continues to melt more fat cells, and most importantly, it tightens the skin and it gives you a really huge improvement. If it also happens that you have some stretch marks on the top of the unwanted fat, laser can be a perfect choice for you because it will help with the stretch marks, and it will even help with the whole tightening for your whole stomach or any area that's being treated. Same as the Body FX. Body FX is a radio frequency treatment that we can basically use it to target any area. It can be your arm, your stomach, your back, your thigh, your cellulite. It's an amazing way to tighten your skin. So Body FX is such a great choice, together with the laser, together with the lipolysis injection, and we also give you home care products that you use at home to continue to melt the fat cells even more. So options are a lot, and of course, when we see someone for the consultation, you don't really have to have all of these options. We pick and choose what will work best for you based on your body configuration, based on your medical conditions, and based on your concerns. So the science behind weight loss, that's a big, huge thing. All of the unsuccessful trials to lose weight in the past was mostly because people are just doing it on their own and they are not really targeting why we put on the weight from the beginning, so that way we can correct it. This is what I wanted to discuss with you today. So hormones play a huge role here, and I do a lot of HRT, hormone replacement therapy. I always make it very clear to my clients when they come for the HRT that I don't advertise for HRT as a weight loss treatment. However, when we start HRT, a lot of times they notice that it's reflecting on their general health and it's reflecting on the body configuration, because a lot of the fat gain is all hormone related. Now, we also have to understand that as we get older, especially after the age of 35 or 40, our metabolic rate slows down. So when the metabolic rate slows down, that simply means if you eat exactly the same food that you ate before, you will put on weight. Why? Because your body is not burning as much. So you will have to continue to cut back on how much food you eat, but that might not be enough. What we need to do for you is we need to boost your immune system as well as boost your metabolic rate, because boosting your metabolic rate is what's gonna prevent this weight gain process from happening or from continue to happen. So I combine basically all of these factors together. Sometimes we have to go on medications. Not necessarily you have to go on medications, but sometimes we have to start the medications to boost your metabolic rate. Medications like Saxenda, Ozempic, Mounjaro, Not necessarily we have to start with that, but sometimes you need it because of other medical conditions that you might actually need it as a medication for, diabetes, for example. And if you are really far from your target weight, sometimes you will have to have the help of a medication to help you with that. So medications doesn't work for everybody. There is no medication in the market that works for everybody. There is no medication that comes with no side effects, but you also have to weigh between the side effects with the medication versus the effect of untreated obesity. This is why the whole treatment plan is being individualized. Everybody is different. There is no size that fits all. And when we see you, we come up with a treatment plan that will fit you the best. So we combine possible medications if needed, a lot of lifestyle changes, and a lot of education. I actually have some of the tools here to share with you that I love to share with my clients when I see them. So here, for example, this is a lovely one. It's called Identifying Your High Risk Time of the Day. I love this one because once you're able to identify the problem, you will be able to work on it much better. So first of all, I hand these materials to my clients so they go home and do their own homework. And when they are part of the program, success rate is so much higher. And when you lose the weight, you can keep it off because you are very well educated on what to do and what to avoid. So identifying the problem can be one of the first things you need to do. So identifying your high risk time of the day. When is your high risk time? Is it in the morning? Is it in the afternoon? Is it in the evening? And the other question we have here is, once we identify when your high risk time is, we need to identify what are you doing at that time? Who is accompanying you? And what time of the day is that? And how often this happens to you? So once you are able to answer these questions, we will be able to tell when the problem is happening so we can avoid certain situations. For example, if your high risk time is 7 o'clock in the evening when you are with your kids and partner watching TV and eating chips. If we're able to identify the scenario, we will be able to change the scenario and keep everybody healthy. Is your high risk time when you're outside with your friends in a restaurant eating and drinking together? Is your high risk time is when you are with your friends in the movie theater? So we need to identify your high risk time because once we're able to identify where the problem is, we will be able to work more on it. So I always give them this homework, work on it. And when do we eat more? Is it happening when I'm bored or when I'm stressed or when I'm busy? Or do I eat because I'm hungry? And if I'm eating because I'm hungry, can I make a better choice? So there is lots to discuss here. One of the great materials that I also love to share with everybody, this is usually I share with everybody when they come to see me for the first time, is how your plate should look like. What do we need to have on a healthy plate? How much vegetables, how much fruits, what type of protein? Don't forget the beans. How much nuts do I need? And if I'm going with some carbohydrates, how to avoid the simple carbohydrates and how to add more grains to my carbohydrates. Now these two pages here makes it so much easier. This whole page here has all of the carbohydrate options and the grain options. And if I'm eating any of these options, how much do I need to eat? So when you go home, you come up with your own meal plan. This is a question I get asked all the time. People keep asking, are you going to give me a meal plan? And my answer is strictly no. Why? Because if I'm giving you a meal plan, you will only be able to follow up on this meal plan for a period of time. And what's going to happen once you stop following this meal plan? Relapse will happen. Things will get even much worse. And that's probably what happened with you in the past. What I need you to do is I need you to make your own selections. I need you to make your own choices. When you are preparing your meal, exactly what goes in the container, what cannot go in the container. So I give you lots of options to choose, lots of the non-carbohydrate options to choose from. So we have non-carbohydrates, how much you need to take from everyone. And another thing that I really love is this one here. So this one is a great way to tell how much you need from every option. So for example, vegetable, you can have a big bunch of vegetables, but when we're talking about fruits, believe it or not, this is how much you have from the fruits. Basically, if you have a fist, we're talking about this area here. So this is not a big ball of fruit. It's not. Once you know that, you will be able to eat the right amount and you will be able to make the right choice. This is how much we expect you to eat from the meal, and this is how much fat you need. That's all. And when we talk fat, we talk good fat like olive oil, coconut oil, avocado, nuts, how much calories you need, and option. So this is such a great way to control your meals. If you need some help with putting things aside to come up with your own meal plan, we can definitely help you with that. More than happy. But we love for you to become your own boss. We love for you to be your own director and you are the one who's controlling what to eat and what not to eat. So that way it's coming from you, not is being pushed on you. Now, there is also tracking your progress. I love this one. You can use a log to capture how you plan and work, and we can also help you with that. So there is lots and lots of materials here that I love to share with everybody when they show up for the appointments. And we basically have materials to share every visit. So we don't give you 15, 20 pages every time you come up here because that can be very confusing. But there is some stuff that I love to share with you now because in my opinion, this is something that we have to discuss every single time. Behavioral goals and values. You need to know why you're trying to lose weight. You need to know your goals. Once we set up the goals and once we identify where the problem is happening, we will be more successful. So this tool is another great one that I love, mapping your best weight journey. So if you don't know it, you're not gonna be able to achieve it. That's another thing. If you drive not knowing where you're driving to, you will never be able to go where you should go. So mapping your best weight journey, and I highly recommend if you are serious about adjusting your weight and optimizing your weight, please do it under medical supervision because we hear a lot about crazy side effects that are happening now when people do things on their own. I don't recommend that at all. And mapping your best weight journey is the best investment you can do for your own health. So we give you these materials. You can use these materials to write it down. So once you write it down, you can see it, you can write it. So it's visualized to you. Chances for you to be successful is so much higher. And understanding the factors that can affect your weight is another one. So again, going back to identifying where the problem is happening and how we can control these factors. So there is so many factors that's listed here. Once you are able to break down your thoughts and once you are able to go through these thoughts every time you crave food that you know that you shouldn't eat, you will be able to be more successful. As you can see here, we have tons of materials, but one of them I really love to show you now as well is finding your best diet. This one here. The reason why I love this one is finding your best diet is where healthy living starts. So it all starts with your grocery shopping. If you shouldn't eat it, it should not go in your grocery cart. If it goes in your grocery cart, you will end up eating it when you get home. So please be careful with your grocery shopping because you should not bring home something that you and your family shouldn't eat. So I know there is a lot to discuss and it can be a little bit confusing sometimes. This is why when we see someone for the first time, we book them for a whole hour to discuss their plan and check their weight, check their vitals. And once we know their goals and once we set up how we will achieve these goals, they are extremely successful. We still bring them every week to make sure that we're all on the same page. Any questions, we are able to answer. We go through their meals and we can adjust it based on they're losing weight or not. So there is a lot to be done behind the scene, and this is why I find huge success in the program. Your metabolism is being influenced by muscle mass, hydration, hormones, activity level, not just the genetics or age. This is why we're here talking about it. Remember, I was just talking to you earlier about the modifiable factors versus the non-modifiable factors. Age and genetics are something that we cannot change, but we can change so many other things. We can change your hormone level. We can change your muscle mass, activity level. This is huge changing. Skipping meals, might not be the best thing, but adjusting your meals, and when we agree on certain time of the day where you will be eating your meals, it's a lot more successful. And excuse me, what's even more important is when we eat a meal, what are we eating? And why are we making these choices? Again, that will all come back to the education that I love to invest with this program. So, eating fat makes you fat. Remember, I was just showing you here. We want you to eat a little bit of fat, but we want you to eat healthy fat. I don't know if you have any questions so far. Do you have any questions, Randy?
No, we don't.
Great. So if you go to the gym or if you have your friends educating you on weight loss, I know that you heard about this all. So you have to be very careful where you get your piece of information from. Because a lot of people now are getting their education from TikTok and from social media. And unfortunately, a lot of times, whoever is educating them has no medical background and they don't really know what they're talking about. So you just have to be very careful when you are giving your piece of information. It has to come from a trustworthy source. That's for your own health at the end. Weight loss cannot be the same for everyone for sure. Weight loss is a completely variable thing. Some people are very effective in losing weight, some people are not. That comes back to something called GLP-1 in our brains. So GLP-1 basically is what goes to your brain and tells your brain that you're full, you don't need to eat anymore. Some people have high GLP-1 so they don't feel hungry. Even when they eat, they can burn the food so much faster versus somebody else who has very low GLP-1 so they feel hungry all the time, and when they eat the food, they cannot burn it. This is just personal variation. Same as we have different skin color, we have different hair color, and we have different genetics. So this all comes to the personal variation that can be different from one person to the other. This is why sometimes it's actually crucial to seek the help of certain GLP-1 medications like the Ozempic or the Saxen, for example, because we really have to introduce these factors to certain people. Otherwise, it will be almost impossible for them to lose the weight. So everything we do is non-invasive. So we don't do any surgeries, we don't do any invasive procedures at all. What we try to do is we try to help you to lose the weight, optimize your hormones, and also help you to lose the unwanted fat, the visceral fat, as well as the superficial fat, like we discussed. So in our program, because I understand that losing weight on its own can be challenging, losing weight and losing fat can be even more challenging. I put it all in one program that will be able to cover it all. How to lose weight. Going through all of these materials can help you a lot to optimize your weight, as well as optimizing how you think about food. What is the relationship between you and the food? Do you think that the food is making you happy? And if you think so, how do you feel after you binge eat? Do you feel guilty? Do you feel bloated? Do you feel sad? How do you feel? And we get our clients to write down their feelings and their thoughts. So we go through these thoughts before we do the same thing over and over. So we need to identify the relationship between you and the food. Once we're able to identify this relationship, we can break it because we can see what else can make you happy in a healthy way. So we can change your way of thinking by identifying where the problem is happening. So we start Ozempic sometimes. Not everybody needs to go on medications, like I said, but sometimes you have to go on something to tell your brain that you need to adjust the food intake, at least at first. Once you're able to, you can do it on your own. Always remember, with the fact that every single medication has side effects, we have to weigh in medicine between side effects of the medication versus the medical condition if it's left untreated. For example, in my family practice, if I'm seeing somebody with high blood pressure and I discuss with them starting medications for blood pressure, I know for a fact that blood pressure medications have side effects. We all know that there is no medication on earth that has zero side effects. That's not true. So we have to weigh, is it better for them to go on a medication and deal with the side effects versus not going on any medications, dealing with the untreated blood pressure? Of course, in this case, going on the medication and dealing with the medication side effects will be a much safer option, because we're minimizing lots and lots of the complications that can happen if the blood pressure is left untreated. Blood pressure can cause stroke, heart failure, kidney failure. It can cause lots of conditions that we can avoid if we're able to get the blood pressure under control. So it's the same thing with the obesity. Sometimes we have to prescribe medications, knowing that medications comes with side effects, but we have to choose between side effects of the medication versus leaving obesity as a medical condition untreated. But like I said, not everybody has to go on medications. It's a very individualized situation. So we start people on medications if it's needed on weekly basis or bi-weekly basis. We do glutathione injection, we do MI, or we call it MEC B12, just to make sure that your metabolic rate will be optimized, as well as you will be able to burn and get rid of the visceral fat. So stay healthy and at the same time lose weight. IV therapy is a great way to boost your immune system. IV is another great way to boost your energy. If you have any aches and pain all over your body, if you have any joints pain, if you have inflammation, if you've ever been diagnosed with fibromyalgia, if you think that you have fibromyalgia, chronic fatigue, IV therapy can be an answer for all of these conditions. Some stuff that's not directly related to the weight loss, but injection, for example, or NAD IV therapy, for example, this can be a great way to improve your energy and minimize your inflammation. We do with alpha lipoic acid, which is also great to minimize diabetes and increase your metabolic rate, as well as improve the neuro system. So for somebody who has been diagnosed with any neurological conditions, this can be a perfect choice because it helps to rejuvenate the neuro system, the central nervous system. So it's all non-surgical options. So we start with medications if needed. We start with some injections, natural amino acids to boost your metabolic rate and to boost your immune system and rejuvenate your cells. And of course, we also do the lipolysis injection that we talked about. We give you the laser treatment as well as the radio frequency. So that way we're able to help you to lose the weight and to lose the fat. So I tried to give you a bit of overview of what we do here. We got lots and lots of questions over the past few weeks about our weight loss, and I wanted to make sure that we're all on the same page. Everybody is aware of what we do, and if you feel like you will be a good candidate for this program. We have different plans. We have 2 months plans, 4 months, 6 months, based on your needs. We can definitely recommend the best plan that will fit you. You can feel free to take a screenshot if you want to, so that way you can see which one works best for you. But this is something that we always recommend when we see someone based on your goals. Remember, we talked about your pathway and your goals and discovering your goals. It all depends on what you're looking for. You have to understand that weight loss is a commitment and you need to be ready to make some lifestyle changes. Don't think that just showing up here and seeing us for a couple of minutes every week will do the trick. You need to be ready to make some lifestyle changes if you're really serious about achieving your goals. Just like everything else in life, we need to work for it in order to achieve it. So if you have any questions, please feel free to text us and one of our team members will reach out to you. They can book you for a complimentary consultation, go through all of your concerns and talk about what's the best diet for you. We talk about how we can adjust our hormones in order to avoid the hormonal fat that we talked about earlier. And we can also share lots of materials with you based on your goals. For people who are in today with us live, if you text us today, we actually have great surprises that will be added to your plan, which is more B12 shots that will be done completely complimentary because we really want you to experience the good response. I personally, when I get my B12 shots, I wake up in the morning very clear-minded and I feel like my energy is being boosted. 2 weeks later, my energy starts to go down. So I know the difference and I would love for every single person who's watching me now to experience the same difference, especially if you're a busy person, if you have a family that's relying on you. You cannot afford being sick and you cannot afford being tired and exhausted. You need to be in a good shape so you can help your family members. So if you have any questions, please feel free to text us at 705-712-3737, or you can feel free to go to our website, rejuvenate.ca, and or you can even give us a call and we will be happy to answer your questions.
So we do have a 5-star review from Pat Ivy. She says, Dr. Bichet and her staff is amazing. She listens to
Thank
my
you, Pat.
health concerns and very thorough in explaining everything to me. I've never felt so good in a long time. I feel very well cared for when I see her. I feel lucky to have her as my medical doctor.
It just happened that I actually didn't read this review before, so it's just making my day. Thank you so much, Pat, for this review. I really appreciate it so much.
We also have somebody by the name of Maggie Joyce. She says, I'm only 2 weeks into the weight loss program at Revive MD, and I couldn't be happier. I'm down 9 pounds. My energy is up.
Wow.
My crazy and food noise in my mind are gone. Plus, other services have to facilitate your weight loss are such a nice bonus to help you see results of your hard work fast. The staff are so friendly and easy to talk to. Makes your entire weekly experience a highlight.
Thank you so much, Maggie, for that. That's an amazing review. Thank you so much.
So
we really appreciate it when people take the time and give us their feedback to see how they like the program, how they like us, and how do they see the whole thing. Thank you so much for these amazing words. It honestly makes a huge difference.
There's a few people on live. Debbie says, thank you for the great presentation.
Oh, thank you, Debbie. Thank you for attending the presentation.
Samantha asked, do I have to start on Ozempic when I first start the program?
No, you don't have to. So Ozempic, like I said earlier, it's an option. Not everybody actually qualify for the Ozempic. So based on your consultation, based on your goals, based on your current weight and your goal weight, and based on how far we are from this weight, you can go on Ozempic. You don't have to go on Ozempic. So it's definitely an option.
Sarah also says, can I join the program? I'm only looking to lose fat, but not weight loss.
So she's looking for body contouring and weight loss. Absolutely. So we actually have a different program that does not include any weight loss. If this is what you're looking for, we actually had a couple of clients in the past. Thank you, Sarah, for this question. We actually had a couple of clients in the past that just joined us for body contouring, especially if they had kids in the past and they had this lower fat in the stomach area, or if they have a lot of cellulite in their thighs. And cellulite, by the way, is a genetic problem. So even if you are in a very good shape, but you have genetics for cellulite, more than likely you will have cellulite in your lower limb and in your thighs. So it's actually a great way to lose this unwanted fat from certain areas like your arms, like your stomach, your cellulite. So even if you're not looking for weight loss in general, body contouring can definitely be a great option. We actually have different packages. Maybe we didn't share it here because we were mostly focusing on weight loss today, as well as fat loss as a part of it. I don't know if I don't think we have shared that here. Oh, so we have this before and after. So the picture is not clear enough, but when you actually look at the picture here, you can see the difference in the tightness in the skin. So not only this amazing lady here was able to lose more fat, but she's able to look much better by having nice tightening to her stomach. So even if you're looking for the tightening, you're not looking for weight loss, the weight is optimal and you're not planning to lose more weight, that's completely fine. But you can definitely go to the body contouring options. Absolutely.
So maybe we can talk about IV therapy and how it helps with metabolism and fat burning faster.
Sure. So IV therapy is a big medical thing. I got into IV therapy about 2 or 3 years ago. I started to learn more about IV therapy. And when it comes to IV therapy, it's not just about the weight loss. Weight loss is just one of the few things that can be achieved through IV. IV therapy basically is introducing your body to a lot of the nutrients that we lack all through our life because of the unhealthy lifestyle we might have, lack of a good sleep, lack of a perfect diet, and the stress that we get exposed to. A lot of things we eat now are not the best. We cannot eat all organic food, and even the organic food has a lot of chemicals. So a lot of times we just need to cleanse our body from all of these toxins that has been accumulating in our body. So when we are talking IV therapy, we're talking mostly about cleansing and detoxing, how we can optimize your health. So there is a difference between medical condition that needs treatment and optimizing your health. Medical conditions that needs treatment is when you go to your regular doctor, go through, let's say, your blood pressure, your diabetes, any heart problem, whatever, you leave with a prescription that has certain medications. This is traditional medicine, which is very important. I'm not underestimating the traditional medicine because this is what I've been doing for so many years now as a family physician. But I noticed over the years that sometimes, or actually a lot of times, traditional medicine on its own is not enough. A lot of times people were coming to see me in my practice and we go through their blood work and it's all good. We go through their testing, their ultrasound, and it's all good. However, people are not feeling very well. People feel complaining of tired, exhausted, aches and pain, inflammation in their joints. So a lot of times I felt so frustrated myself as a practitioner, telling my clients that everything looks good with you when I know deep inside that they are not good. So I started to look into options, saying, so there must be other things that we need to do that will be able to help my clients even more. This is one when I started to get into HRT, the hormone replacement. This is when I started to get into integrative medicine and try to offer options, not just to treat a condition, but to optimize health. So when we're talking about IV, we're talking about optimizing health. So optimizing health through high dose vitamin C. High dose vitamin C is a great way to boost your immune system. There is actually a lot of studies now claiming that high dose vitamin C can even help to cleanse cancer cells and it helps to increase the longevity in cancer clients. We also have, these are studies, but if somebody has cancer, we never ask them to stop their chemotherapy treatment or they stop going to the cancer clinic. It's a completely different thing. We're talking about something that can go as a supplement, but not to replace active treatment. Just to make it very clear, same as I for MEC, the MIC, B12. This is a great way to boost your immune system. We also have the glutathione, the one that we were just talking about, which is a great way to clean visceral fat and to cleanse the visceral fat. We also have something that's called NAD, N-A-D. NAD is a great way to stimulate something in our mitochondria. It's called the ATP, is the energy factory that is located in our mitochondria in our cells. So NAD goes to the ATP and stimulates the ATP to produce the energy. If you have chronic fatigue or if you're lacking energy, maybe it's time to try the NAD. If you're not ready to try IV, at least to try shots are just like a 1 minute appointment. You just come for the shot and go, and you will be able to experience very nice results even after the first shot. Plus, when we're rejuvenating yourself, you started to notice that it's giving you anti-aging effect. But I want you to think about it this way. Even if you don't care so much about looking younger, if something is making your face looking younger, what is it doing to your internal organs that you don't see? It's making your liver younger, it's making your kidney younger. So even if you don't care about the anti-aging effect, it's actually great to rejuvenate and re-stimulate your actual organs that has been calm and tired over the past many years. So meal planning is something that we can definitely help you with. If you are planning to prepare your own meals and you need help with that, through all of these resources, we can definitely help you to do that. We actually give our clients based on which program you're at, but if you are in certain programs, we actually give you access to an application, a phone application. This application gives you access to dietitian, gives you access to meal plans, fitness classes, pharmacist, medical director, nutritionist. It gives you access to everything. That's all included in the program. This application usually is $500, but we give you free access to it. That can be up to 12 weeks. You will have your own coach. You can set up a coaching call with your coach and you can get them to answer all of your questions that beside coming to us to see us. So you cannot be happier and you cannot be more successful when you're having all of this great support at hand and having all of these options. So these are some examples here. I will take you back to this when we were talking about how your plate should look like. And when we talk about the plate, we talk about having so many different colors from the vegetables, having less fruits than the vegetables, focus on the berries like strawberries, blueberries, having good amount of protein. Again, protein can be white meat, fish, it can be eggs, it can be tofu, it can be beans, and also a little bit of handful of nuts is a good one. I always tell my clients before they start eating nuts, you need to have your shares in a plate and then put the bag away, because if you don't do that, you will just eat from the bag up until the bag is finished. So we need to make sure that we regulate how much we will eat in advance, so that way we are more successful. And when we talk about the carbohydrates, we're only talking about grains, and we're not talking about simple carbs like white bread and white pasta. We don't want to see this in our plate, because this is just the like simple carbohydrates that will drive your sugar very high and that will drop very fast. We don't want that. Instead, we talk about how to make it even more successful by using something that has more fibers. It will take longer to drive your sugar up and it will take longer to digest, so it stays in your stomach more. So we can definitely help you with some meal options. Drinking so much water is crucial, especially when we do any lipolysis options, whether it's the injection or even the laser or radio frequency. We always make sure that people will drink good amount of water, because this broken fat cells needs to be flushed out of our system. So we want to make sure that we will get rid of them. So thank you so much for being with us today. Thank you so much for attending our presentation and the webinar. Please feel free to text us. Again, it's 705-712-3737. If you have any if you have any questions. Our program starts at $499. So we're not doing anything that's breaking the bank. And this is all what's included in the program. When you only pay $499, you will have the access to the prescriptions if you need it. But most importantly, you will also get the Fotona TightSculpt. This is regularly $699. But if you are part of this program, you will get this at $200 discount plus everything else that comes with the program. You will get the MIC and B12 shots, which will help with your energy level. It's amazing for energy, boosting your metabolic rate, and even help you to sleep better. You will also get our complimentary Visia skin analysis. This is usually $150. You will get it all complimentary here. Plus, if you qualify for the Ozempic prescription, I will be able to prescribe Ozempic for you if you qualify for it. This is all at $499. But again, if you sign up today with us or if you text us today and book your consultation, you will be given an extra booster shot. So if you have any questions, feel free to reach out to us. Do we have any questions, Randy?
Not right now.
Perfect. I think we're on time. We're not late. And you can feel free to let us know if you have all of our information here. If you're not following us on Instagram or Facebook, please do so. We would love to keep you posted with all of the upcoming webinars. And talking quickly about webinars as well, we have lots and lots of questions that keeps coming to us through emails, text messages, or even verbally when our clients show up here. So we decided that we will be arranging at least once a month. So in this webinar, we will be able to clear these questions, give you a professional answers. So like I said, you don't want to get your information from TikTok or from social media. When it comes to medical information, you want to make sure that this will come from a medical practitioner. So if you need to learn more about any other topics that we teach, please feel free to let us know so we can address that in the future webinars. We would love to talk to you about the topics that you want to hear about. So please feel free to text us or email us. You have all of the information here. The email will be info@revivemedspa.ca, or you can just feel free to text us. So thank you so much for being here, and we would love to help everybody to be successful in their journey to optimize their weight and optimize their health.